and thanks to all speakers. So now it's time to Dr. Hayati Aygoun from Medicabil International Hospital. The topic of this topic will be the role of UBE endoscopy surgery. So it's your turn, Dr. Hayati.
Oh, sorry, you mean okay, so you mean as or the number or in Japanese situation you asked?
Hello, Dr. Ito, and we move to the next speaker from the Turkey. Thank you very much.
Thank you very much.
And also thank you very much for the Dr. Hussein host and their Indonesia team.
Hello, do you hear me?
Yes.
Okay, thank you very much. Dear Chairman, first of all, I want to thank the organizing committee for their kind invitation. I'm very happy to be in this valuable meeting, and I will present you the role of biportal endoscopic decompression in spine surgery. Actually, I'm very happy to see before the speaks from my master Dr. Song and the others. So my presentation will be a summary for all before the presentations, because I saw very important presentations to compare the UBE with the other techniques is very important. And my presentation plan will be like this, as you see in this slide. And you know, spine surgical techniques are classified as open, MIS, and the endoscopic techniques. Endoscopic techniques also can classify as biportal and if you know the endoscopic surgery as biportal or uniportal. And you know the endoscopic surgery is growing day by day. The spectrum of indications for endoscopy is widening, and the microsurgery is losing its role as gold standard technique. If we go more detail, endoscopic techniques are classified according to the portals. There are two main techniques, as uniportal and biportal. If they classified according to the application medium, also we have again two main group, the air medium and the fluid medium. But if they classified by Spine consensus nomenclature paper, there are two main groups, full endoscopic and endoscopic assisted techniques. The UBE technique is the last generation endoscopic technique, and it's kind of hybrid technique. So the technique has a special role in spine surgery. It means that the UBE is an endoscopic method. Also, it can classify it as full endoscopic technique because it's carrying the only full endoscopic surgery properties. For example,
hello, Dr. Hayati. We cannot see your presentation to play.
I shared actually, but
yeah, can you share your screen? Not share your presentation. Share your whole screen.
Interesting.
We can cancel it and share your screen again.
Okay.
Cancel the sharing and reshare.
Yes, I canceled.
Yeah.
I'm sharing again.
Yeah. Yes. The first choice. The left on the right. The left on the top.
Right.
Left on the top.
Left on the top.
The first one. Share your screen.
Yes, I doing. I couldn't see my desktop to share. I couldn't see my desktop to share. I couldn't see my files.
At the bottom of your computer.
Yeah, I know. I trying to share and
yeah.
like this.
Yes.
Okay, then.
Your screen. Yeah. Yes, you can find your presentation.
I'm so sorry.
It's okay.
So I have to start from begin, right?
Yes. Yes,
okay,
please.
Thank you. I'm sorry for the problem. I'm starting again. Dear colleague, my presentation plan will be like this, as you've seen in this slide. And you know, the spine surgical techniques are classified as open and MIS and the endoscopic techniques. Endoscopic techniques can also classified as uniportal and biportal. As you know, endoscopic surgery is growing day by day, and the spectrum of indication for the endoscopy is widening, and the microsurgery is losing its role as gold standard. If we go more detail, endoscopic techniques are classified according to the portals. There are two main techniques as uniportal and biportal. If they classified according to the application medium, also we have again two main groups, air medium and the fluid medium. But if they classified by Eospine consensus paper, there are two main groups, full endoscopic and endoscopy assisted techniques. UBE technique is the last generation endoscopic technique, and it's a kind of hybrid technique. So the technique has a special role in the spine surgery. It means that the UBE is an endoscopic method. Also, it can classify it as full endoscopic technique because it is carrying all of the full endoscopic surgical properties. For example, the surgical interventions completely performing under the endoscopic visualization. Additionally, UBE technique is performing with the microsurgical principles. So, if we define the UBE technique, we can say that UBE is a surgical technique which has been performing under endovisualization for percutaneous, minimal invasive spine and spine-related structure surgery. This technique has many differences from others. It has widened visualization, which has most beneficial failure of view capacity. It is a very crucial point, the failure of view capacity. Also, it has high orientation capacity by help of separated portals, despite of the fact that some canals or retractors uses for facilitating of the tool passing in working portal, but it is a real percutaneous technique. The technique is applicating in fluid medium. Hydrostatic pressure can be used very effectively by controlling of the fluid flow out. Additionally, it has flexible size working portal, which can be widened by using the retractors for using different tools. So the technique has big advantage in terms of unlimited tool usage. And in this table, you see the UBE advantage. Almost all the surgeries UBE superior or equal results with others. If we compare the endoscopic technique, UBE has many advantages besides minimal disadvantages. In all circumstances, UBE has very useful failure of view capacity, strong tools and big radiofrequency electrodes with different shape and size using is possible. The surgery can be done with conventional surgical tools like microsurgery. Another big advantage of this technique, assistance can be joined actively for retracting of the neurological or muscular structures. So you can use your assistant hand as an additional hand in this surgery. So but in other techniques, you know, you cannot use the assistant hand actively in this surgery, in the monoportal or uniportal surgeries. In this surgery, uniportal technique has more useful because of preservation of the fleum. In UB technique, if surgeon can do fleum sparing technique instead of phlebectomy, this disadvantage can be reduced. Separated portal usage is providing the unlimited tool usage and unlimited access to the target points. If we compare this technique with the microsurgery, UBE also has many advantages, as you've seen in this slide. First of all, UBE is a real percutaneous surgery, so the muscles and ligaments can be protected from devastating effect of the surgery or the muscle retractions or occultations. And the fluid medium endoscopies, especially UBE, the dura is deflated by hydrostatic pressure, so endoscopy is providing more and clear working space when compared to microsurgery. In another word, if you try to the microsurgery for adjacent segment, the surgery became open surgeries. But the endoscopic surgery can be done for multi-level surgeries. Let's see all this in some videos. This is the disc surgery. In this video, we have seen that how the technique is effective for preserving the surround and innocent tissues. We're doing separating of the fleum from the lamina after 1 or 2 or 3 millimeter laminar drilling. No need to the phlebectomy to do this is the 2 millimeter dissector. Now you see the disc fragment. Now we're doing the fragmentectomy. The crucial point is the pre-operative planning. If you do proper planning, pre-operative planning, you don't need to touch the peridural or epidural and the phleum interface. It's very crucial to preventing of the fibrosis and development. Just with doing fragmentectomy. The differences with the other techniques, the clear visualization and unlimited tool usage without bleeding and controlling of the hydrostatic pressure. Just removing the fragments. No need to touch the other tissues, even small vessels. Yes, it's finished. And the other case. This is congenital stenosis with the disc herniation. The case was very young. Now, in this video, you will see the circular spine endoscopy. Circular spine endoscopy. With UBE, we can do circular surgery. It means that I will show you another video. We also can do the foraminal decompression, lateral recess or subarticular decompressions, and the disc decompressions or discectomies or fragmentectomies. I want to make a little faster. After decompression, now we can manage to the disc. Another big advantage of the UBE, you can use the different shape or size radiofrequency electrodes like this. And also in young cases, we can do disc preserving surgery. No need to lose the disc. I want to faster a little bit. Now you see the disc moving. Then here is the immediate postoperative MRI. Then now you see the third month MRI. If you notice that there is a disc hearing, can be seen. In stenosis surgery, we can do foraminal decompression, I said before. In degenerative stenosis, UBE has the open surgery role to do total foraminal decompression. Osteotomies, big tools, and multi-level surgeries can be done under the clear visualization. Please see this video. Another big advantage of the UBE, you can change your endoscopic angle. I'm using generally two different angle endoscopes. I'm starting with the 0, then if I need, I going to with the 30-degree endoscopy. Now you've seen the 30-degree visualization. Here is the left side traversing nerve root and the foramen. this is. And here is the contralateral side upper foramen. Again, we seen under 30-degree endoscopic visualization. In UB technique, we can use these strong tools, osteotomes. So this is the big advantage. Now, actually, we are doing the microsurgery under the endoscopic visualization and percutaneously. Now you see in the contralateral side disc management, and we can follow the nerve root inside the foramen without causing any instability. This is contralateral side exiting nerve root. Then this is ipsilateral side, contralateral side. Again, traversing nerve root, ipsilateral traversing nerve root, and the foramen completely decompressed. Here you see again. Then here is the ipsilateral side upper foramen, or ipsilateral side or left side exiting nerve root and the foramen. You can see the under the 30-degree endoscopic visualization clearly. Then here is the again contralateral side, both of nerve roots and the foramens. Now here's the postoperative MRIs and immediate skin stitches. Another important point of the UBE, the success of the paravertebral in paravertebral surgery. The paravertebral surgery is the paravertebral or lateral pathologies are challenging situation for surgery because of complex structures. Foraminal or far lateral pathologies also can be dealt with UB effectively because of clear and wide visualization and independent tool usage. Paravertebral surgery area can be dominated effectively. Let's see a sample paravertebral surgery. Here you see the very severe L5, S1, far lateral and lateral complex narrowing. And here is the surgery. Here is the SAP of S1, tip of SAP removing with the tool. Also, we can use different shape and size, kerosene punches, osteotomes. I'm using for this the curved kerosene punches and rotatory kerosene punches. It's very important. Now, here is the very soft, flexible tissue. And we, in the surgery, we couldn't be sure about this. Is it disc or another thing? So we used for this the sharp knife. And also, I want to show you the sensitivity of the UBE during the surgery. You can use very sharp tools. Then we noticed that it was just the disc fragment. If the surgeon follow all the procedure steps, all the surgery became enjoyable under the endoscopic visualization. Then I want to show you the post-operative pictures. Now you see here is the foramen, and here is the foraminal widening. In some of circumstances, stabilization can be necessary as an additional procedure. For example, to make stable after deformity correction or listhesis reduction or accurate instability, UBE is an alternative technique also for the open surgeries. In this video, also I will share you the endoscopic interbody fusion. You can put the different shape and size cages, almost all lumbar levels. It's a very safe procedure, and you can do everything under the real visualization. As a completion, UBE has a strong role in spine surgery as an alternative for microsurgery because UBE technique is based on microsurgery but performing under endoscopic visualization. Thank you for your patience.
Thanks, Dr. Ayati, for your presentation. Now, let's turn to Dr. Takaki Yashibuzu from Sir Amatsu General Hospital, Japan. His topic is full endoscopic transcambling triangle lumbar interbody fusion using UBE.
Dr. Sharari, merci beaucoup. I'm Takaki Yoshimizu from Shizuoka in Japan. Can you see my slide?
Yes, yes.
Okay. Today, I'd like to talk about is full endoscopic transcambling lumbar interbody fusion by using UBE.